So in this session, I would like to share about nursing roles in supporting diabetes patients in Singapore, the various challenges of diabetes-related complication during fasting, especially in our current pandemic situation, and the approach in nursing care and caring for our patients during this situation. We all know the ill effects of COVID-19 had onto us. However, this pandemic is not over and we have to learn to live with it. As quoted here by our Singapore Prime Minister, Mr. Lee Hsien Loong, we have to living with COVID without fear. Okay, what about us as healthcare professionals in supporting our patients with diabetes who wishes to fast? We are blessed with the plethora of support and guidance. And one of these articles, which I enjoyed reading it very much, is about preparing Muslims with diabetes for Ramadan fasting in Singapore. It is a clinical approach which included the Dar guideline and preparing our Muslims with diabetes, and it is very helpful, especially in patient assessment with risk score, medical and religion recommendation. Others include like the 2020 update, applying the ADA and EASD, implanting a decision cycle for patient, as example like the assessment, patient characteristic, factors impacting the choice, shared decision, smart planning, ongoing monitoring support, and review of the plan. As today's topic is about the role of nurse, allow me to briefly share on the nursing roles and responsibility in Singapore. Number one, we do have in primary care where we have our health counselors. In hospital-wise, we have a diabetes nurse educator. And of course, in the community, we have our community nurses who are seated at the heart of patients' vicinity area where they actually, patient can actually come down to them or they can go over to patient's place. Across this continuum, we do have our advanced practice nurses in supporting the care. And these include support such as complication screening, education and patient support, disease monitoring and symptoms management, proper glucose management, injection techniques and care. We know that when our patient, when we teach them one time, they can never register many things. So these areas are helpful for patients to retain the knowledge that they've gained. Somehow or other, there'll be some areas where there is a need to escalate patient's condition, such as diabetes-related emergency. We need to reinforce on sick day management. And in hospital itself, we have our nurse-led hypoglycemia protocol in case the patient develop hypoglycemia and while waiting for the doctor, the nurse can do something. And on top of it, there should be a good communication. If we find that our patient needs some support, whether in renal dialysis center or in polyclinic, in the primary care or in the community, we will send some memo to update and provide the progress of the patient. On this next slide, I would like to share about a qualitative study. This is about our diabetes patient experience. So within this study, during Ramadan, they have come up with several themes during Ramadan, behavior strategies and coping, and healthcare wise. One, during Ramadan itself, the patient would mention, at the first week of fasting, I feel weak. And then my body tolerates and adapts fast. Then I'm okay. It makes me feel mentally and physically strong and lighter. Then what about the behavior strategies and coping? One of the patients mentioned, I haven't done my normal routine while compliant with the therapeutic dose based on experience and symptoms during this period to avoid hypoglycemia. We all know hypoglycemia is not something that is nice to live with, where you have to take the sugar water and then repeat, check again, and then if it's not good, you have to repeat again. It's not a nice experience. So with this, what the patient mentioned that after this period, I shall start to perform my normal activities. It will give them the something like a hope. What about healthcare wise? I've discussed it with my nurse and she said, the choice is yours, but you've got your medication. She pointed out that I have long gaps. I don't know how it's going to affect me. However, I have asked them and they say it's my choice. So how can we help our patients with this? Patients are actually committed and passionate to fast. Hence, we need to provide smart goals for them and prepare them early, as what has mentioned before, education. as healthcare professionals, we need to be patient advocate, hence upskilling and involving in research activities will help us shape in new direction for our patient care. What about our other clinical challenges for our patient during this pandemic? As what we know, we are always constantly facing with hypoglycemia, hyperglycemia. They may not eat or drink enough during sahur time, or perhaps they could also be higher risk to develop thrombosis. But now with the pandemic, they are worried about being infected with COVID-19, and what we have learned earlier just now, we should be actually be sharing the patient what is this COVID-19 and diabetes have to do with them. And the fear of vaccinated is very real until that now it have to be mandated. So hence, as nurses or healthcare professionals, we need to be up to date with all the latest notes and updates on COVID-19 and all the safety measures. Hence, with the guidelines, nurses are empowered, can be empowered to provide comprehensive, continuous, holistic nursing care alongside the medical team. And what is this? This is via the health awareness, primary prevention, prevent and manage complications, understanding the risk stratification, providing high quality education and effective monitoring. There's no point starting a patient on insulin or on medicine when they are not being monitored, because there's a need to make some adjustment to their dose. There should not be any disruption of medication supplies or confusion in their dosage. Sometimes patients may not be able to grasp well while we are telling them, okay, Mr. Ahmad, your morning dose will be 10 instead of 20. Somehow or other, a lot of things they are not able to register. So care need to be accessible to patient and assist to reinforce on COVID-19 measures. Example, will swabbing cause me to invalidate my fast because it's through my orifice? No, it's not, because it doesn't give any nutrient. So what about masking? I'm so tired wearing my mask. No, it's important because it is kind of transmissible. And when we talk about social distancing, we know a lot of times our patients are not able to comply to it. And then, let me share with you about a recent patient education. We call it DEAR. DEAR means Diabetes Education and Medicine Adjustment in Ramadan, which is done in SGH. Patients are enrolled and supported prior Ramadan with the necessary skills and education. And result shows that female form the largest percentage, okay, and 90% of them are DM with type 2 with a mean age of 60. And they managed to fast for about 14 days with 92% actually had their medication adjusted. Something that is very nice to hear is that there's a decrease in complication of hypoglycemia from 13.8 to 10.3, and there was a decrease in complication of hyperglycemia from 31.0 to 3.5. The HbA1c has dropped down from 8.8 to 8.5, and of course, their weight 76.6 to 75.9% at 75.9. What are the tips for nurses to deliver effective counselling? Just want to share with you, these are some of the skills that we pick up along the way. Firstly, nurses can understand and assess patient learning abilities using the VARC learning style, which the visual, because some patients, they learn through looking at. Some of them learn via auditory, their hearing. And some of them will like to read and write, but be mindful. Some of them went to like Dr. Google, Dr. Yahoo, so we need to pull them back to reality and explain to them. And some of them like to write, writing their blood sugar level, what are they eating, and it's okay because that's part of their learning process. But some of them will be very eager to show you, hey, is this the right way to do my insulin injection? Is this the right way I do my finger prick? And one thing about us as healthcare providers, sometimes we like to have these care tactics. We like to give them advice. You must do this, you must do that. Bettering highly directive styles like parenting style. We need to cut down on this. What about the next one? Motivational interview. We need to ask open-ended questions, not a closed-ended question. Makes affirmation, use reflection, and summarize it for patient. Other tips that I would like to share about when you see your patient at the counseling side, there are several areas of assessment to cover. One thing first, I've always liked to discuss with them about their current HbA1c, what's their number like, what's their blood pressure like, and what's their cholesterol like, what was their fasting experience last year, was it good or not. Most of the time, patient will say, last year I can fast, so that means this year I can also fast. Somehow or other, you got to explain to patient, last year because your condition was this, our body will change around some time, so we still need to make preparation and planning for ourselves in order to fast safely in Ramadan. What about their medical history? Do they have any comorbidities? What kind of occupation are they having right now? Are they Grab drivers? Do they do night shift? Are they staying alone? What kind of diet do they have? Someone cook for them? Have they had the medicine been adjusted? When something about glucose meter, I won't ask them straight. Number one, do you check your sugar level? I ask them in such a way that when was the last time you do your sugar check? Because some already they will say that, I did my sugar level reading, it was 9 to 10. But then again, that was a couple of months back. And what was their target like? To them, if it's like 11, 12, it's fine. But then again, we need to individualize them. We need to also find out whether do they adhere to the medicine and injection, and what kind of exercise they do. So during Ramadan, do they do Tarawih sessions? These are important things where if once you have it, you can pull them down and then strategize on how you like to teach the patient. Because we need them to recognize problems, whether do they have any hypo or hyperglycemia and what do they do. And the next thing, sometimes we forget who is their point contact. Sometimes they are really alone, they do not have anyone to be with them. On the other hand, I would also ask them to do some trial fasting in order to support and for them to have a feel rather than they fast on the first day of Ramadan. Remember just now I mentioned about problem-solving skills. This is an example which I always discuss with my patient. Whatever numbers that they have, do not ridicule, do not like, how come your sugar level is high? You just accept as what it is. So for example, for this, it was 10.6. All right. Fasting period, the person did a trial fasting, 14.3. And then before breakfast, breaking fast, it was 3.8. It was a bit low. So probably you would like to know more what happened. Did they do any activity? And then after post meal, it was 11.7. You already have that thought. Must be eating something else. So before we jump into conclusion, we need to ask them, how willing are you able to check your sugar level? Understand and assess their understanding how, when, where, and why. Because we need to ask them, what is the cause of your high sugar level? Do you do the glucose, do you do the checking it using the correct meter? Do you take the right dose of medicine? Do you take any extra portion? If yes, you try to reflect and find ways to prevent it. And when should I break my fast? So these are the things that is running in my mind before I confront to the patient. So when that happened, patient will say, in the morning, I forgot to take my medicine. It was a bit hypo because I was running up and down trying to clear my work. And I was so hungry that I take extra portions. So whenever we see this, we shouldn't be being punitive, but again, guiding them for them to improve. Some patients, remember just now I mentioned, they like to write, they like to see, they like to observe everything. By all means, let them write, let them see. And what they see there, they can actually reflect and improve further. So I do have some patients who write every single activity that they do, what kind of food that they eat, what's the sugar level like, and what's the medicine that they're taking. And from my observation, mostly some of these patients can be accountants, can be engineers who are very precise about numbers. And then we know about the evolution of continuous glucose monitoring. If you look here, this is I'm sharing from my patient in March itself on weekend. Our patient sugar level actually went up 16, 14, and on Sunday also it was a bit high until to the sky, and then on Monday itself it was high. So I asked him, Mr. J, what happened? And he told me here, lately I was attending to kanduri. So kanduri is like a feast, wedding invitation. I don't know how many wedding invitations he attend. And he told me, he reassured me, don't worry, I will jaga my makan. Jaga is look after. Makan is my eating pattern. I'll make sure I don't miss medicine and give the right dose. So I actually was happy because he's able to reflect, and I was hoping that he'll make changes. True enough, on the next following days, the sugar levels has between the gray zone, which is between the 4 to 10. And I actually praise him for being a good student. Earlier just now, we talked about consultation tips. In this era of pandemic, there will be some situation where we need to adhere to change the way we do our consultation. Either we go by telephone or either we go video conferencing. This is from what these are some of my tips which I have applied and I've learned. When you do patient education or you want to find out whether the patient is doing well or not because they're not able to come, make sure you speak to the right person. Okay, you speak and then establish the purpose of the call, confirmation of the past history, because you don't want to give wrong information to the wrong person, or you may disclose something which is not nice or something which the person has not want other people to know about. You start with an open question. Ask about any specific signs of deterioration. Give clear safety advice, signs of worsening, what to do. For video conferencing tips, I must say that many are not comfortable talking at camera. Some of them say, I don't know, I leave it to my children. But then again, if you can recall, our elderly, even my parents, they're very good at WhatsApp, they can look at Facebook, they can do other things. So learning and doing video conferencing via Zoom wouldn't be that difficult. If you lay out the steps, step 1, download, step 2, do this, step 2. If you have it in pictorial, they will be able to follow through. Use a well-lighted room, because some more rather you need to see them how they are. Remove distraction behind us. Show your hands and your arms that we are talking, or if not, we think that it's just a still picture. Take note of the non-verbal clues, breathing colors, signs of pain or discomfort. I do have, the other time I was doing some on this, a patient actually said that I can't breathe, I cannot do, my breathing is difficult. Then again, I cannot continue the session. I say, ma'am, I think we need to stop and I'm not able to see you. You need to call the ambulance and they come and fetch you and quickly bring you down. And true enough, our friend, our patient need to be admitted. So now, next one. We know so much about COVID-19 that has affected our mind. Exercise and mindfulness during Ramadan is something that we can consider. But however, we need to avoid rigorous exercise, especially during the last hour of fasting. We can continue our normal physical activities. Special prayers are actually a very good example of physical activities. More nightly prayers performed more are likely to improve HbA1c and weight management. We can also improve in our mindfulness in this calm state by listening to podcasts. Like for example, this is done by our Singapore Mufti, Dr. Naziruddin. But of course, must be the legit site, because if not, we will have other stories. So in summary, nurses play an important role in supporting patients with diabetes who wishes to fast safely. These include good communication skills, assessment, understanding, and tailoring to their needs and their lifestyle. Fasting should be recommended after restrictions. If face-to-face consultation is not possible, do explore on telehealth or video conferencing. Self-care and mental health should not be ignored, and this includes us as healthcare professionals. Empowering patients is the key to success for safe fasting. With that, I thank you